Hello doctors. Welcome to my clinical book. Today I want to discuss an interesting real-life clinical scenario with you. This would be our clinical case, 11. Let's read a clinical history of patient. A 52-year-old man diagnosed with multi-drug resistant tuberculosis. For that, he requires second-line drug agents for his therapy. And we also notice that, on the reports of kidney function test, he is found to have a creatinine clearance of 50 milliliters per minute. After reading this clinical history, what do you think? Which fluoroquinolones can be started in this patient, without dosage adjustment? Take 20 to 30 seconds. Think about the best suited fluoroquinolones in this case. Comment us your answer. Your comments will be highly appreciated. Okay, let's discuss. Let's first highlight the main indicative points of this case. So, first thing is that our patient is diagnosed with multi-drug resistant tuberculosis. The normal values of creatinine clearance by kidney in males is 97 to 137 milliliters per minute, or 1.65 to 2.33 milliliters per second, and in females, 88 to 128 milliliters per minute, or 1.496 to 2.18 milliliters per second. But here in this patient creatinine clearance is 50 milliliters per minute. It mean patient have some renal issues. It can be a renal failure. Now, the patient of multi-drug resistant tuberculosis having renal issues requires second-line drug agents for his therapy. Do you have any brief idea about fluoroquinolones and TB? Let's quickly read about them, so that we can choose the best fluoroquinolones for our patient. The fluoroquinolones are a family of broad-spectrum systemic antibacterial drug agents that have been used widely as therapy of respiratory and urinary tract infections. These agents are believed to act by inhibition of type II DNA topoisomerases, or gyrases, that are required for synthesis of bacterial mRNAs, which is transcription and DNA replication. Most commonly given fluoroquinolones, or second-line drug agents, in TB, are Ciprofloxacin, Ofloxacin, Levofloxacin, Ciprofloxacin. And commonly given antibacterial agents, as first-line drugs in TB, are isoniazid, rifampin, pyrazinamide, ethambutol. Remember this fact about the first-line and second-line drug agents used in the treatment of TB. The first-line therapeutic drugs are the most effective and least toxic, while the second-line therapeutic drugs are less effective, more expensive and have higher toxicities, but they are, however, essential for the treatment of drug-resistant forms of the bacteria. Now, we know what are the drugs used in the treatment of tuberculosis. Let's clear a little concept of TB. Tuberculosis, or TB, is an infectious disease that most often affects the lungs. TB is caused by a type of bacteria called Mycobacterium tuberculosis. It spreads through the air when infected people cough, sneeze, or spit. Multidrug resistant TB is caused by TB bacteria that are resistant to at least isoniazid and rifampin, which are the two most potent, first-line, TB drugs. Now, we know little about TB and their drugs. Let's come back to our clinical case. Drug of choice for the patients diagnosed with multi-drug resistant tuberculosis, and having renal issues must be that one which does not predominantly depends on kidneys for their clearance or elimination. Most of the available fluoroquinolones are cleared predominantly by kidneys. So, dosage needs to be adjusted in patients with renal failure. But fluoroquinolones such as Moxifloxacin and Ofloxacin undergo hepatic elimination, and so should be used carefully in patients with liver disease. Our patient's liver is healthy, so we can use these drugs without dose adjustment in our patient. So, second-line therapeutic drug for our 57-year-old patient diagnosed with multi-drug resistant tuberculosis and having renal issue is Moxifloxacin.